Well, it's my pleasure for everyone joining us in New York or Eastern Standard Time to officially welcome everyone and say good afternoon, and wherever you're joining us from, good morning, good evening. Welcome to today's Concordia Live, co-designed and hosted in partnership with our global patron member, the Kyle House Group. For those of you who are joining us as guests of either Kyle House Group or one of our speakers, Concordia is a New York-based nonprofit dedicated to promoting public-private partnerships and positive social impact through our Convene, Connect, Create model. We're best known for our annual convening, which serves as the preeminent global forum alongside UN General Assembly each fall, but we have a robust year-round program, as well as dedicated team members to support our members in their partnership design, growth, and implementation strategies. Essentially, we are your SDG 17 partner and person. So if you're not a member, I'd encourage you to learn more about our programming, membership, and how to join by reaching out to membership@concordia.net. If you are a member, I'm so glad you're here and chiming into this important topic, which you'll know is a theme for us this year. And I'd encourage you to connect with my team about the Concordia Action Alliance and our dedicated partnership work around natural disaster and global health related matters. So I'm so pleased that we're able to collaborate with the Kyle House Group on this important topic. Kyle House Group's founding partner, Porter Delaney, has led a number of public and private conversations with Concordia related to health delivery and the COVID-19 vaccine rollout. And he's also been active in our innovative financing related programming. So today's conversation will explore strategies to develop working capital necessary to finance closing healthcare gaps. So that really brings these two pieces together, and we couldn't be better positioned than to have Porter run us through this. Before I turn everything over to Porter, though, I'd like to introduce before I turn everything over to Porter to introduce the topic in full, I would like to welcome, on behalf of Concordia, our speakers and provide some spot me guidance, especially if this is your first time using that platform. So I'm welcoming to today's conversation Sibusiso Hlatjwako, South Africa Country Representative Advocacy and Partnerships Manager at PATH. Our friend Ben Hubbard, who spoke at the annual summit last year. He's the CEO and co-founder of Parcel. We have Nafisa Jiwani. She's the Managing Director for Health Initiatives at the U.S. Development Finance Corporation, and Sean Keogh, Vice President of Nathan Associates. Before we turn to the conversation, I want to make sure everyone here is maximizing their time in the space. So for the next 45 minutes, I encourage you to actively use this chat feature. Listeners are encouraged to use the Q&A feature for SpotMe to ask their questions. Porter will be drawing from these at around the 12:30 Eastern mark and occasionally peppering them into the discussion as well. So make sure your questions are being asked and answered by this illustrious group of experts. And then in the chat feature, introduce yourself. We want to know who's here. We want to know what you're doing in this space and how it connects back to the topics being raised. So make sure you introduce yourself there. And of course, take the conversation online. You can join and share any illustrative remarks and comments made by our panel, or just the questions you might have over social media, tagging @Concordia Summit. This webinar is recorded and available via our website post-event, so you can share it with your network, and we'll have a summary of today's conversation go out as well. So with all that housekeeping nonsense behind us, I'm so happy to turn it over to Porter and let this panel really kick it off. Porter, over to you.
Great, thank you so much, Hannah, and thanks to the Concordia team for inviting us to partner again. So as Hannah said, the topic for today's discussion is how to mobilize health delivery for global COVID response at really an unprecedented scale, and the need for new public-private partnerships to overcome major challenges and constraints to the delivery of COVID vaccines, treatments, diagnostics, and other critical health services and supplies, with the fundamental goal of achieving equitable global access. And so we're having this discussion at an interesting sort of inflection point where we're starting to see really significant increases in availability of vaccine, and manufacturing is starting to reach really impressive levels. But we know we're also seeing really tremendous disparities in terms of availability of not just vaccines, but as I mentioned, treatments and diagnostics and other sort of health supplies that are required to effectively respond to COVID internationally. And I think we all start from the premise today of understanding that the global population, for those chiming in around the world or those in the United States, wherever you are, our populations aren't going to be safe until we have the virus under control everywhere around the world. I wanted just to level set at the beginning with a few kind of current facts and figures. Then we're going to turn to each of our four panelists to provide their unique perspectives on sort of the state of the global response and unique solutions that they've been developing around risk mitigation, finance, also just get some on the ground perspective as to what is being seen at present, and then also talk a little bit from a donor standpoint about how finance is being leveraged to help with the response. So again, just a few kind of facts and figures to start, and then I'll turn to our panelists. So as I mentioned, as we've seen a big increase in manufacturing, there's some encouraging signs. There was a Duke University report that came out just a few weeks ago that identified that we could manufacture globally 12 billion vaccines by the end of the year. If you put that into the context of studies that show you need 11 billion vaccines to reach herd immunity globally, you'd be quite optimistic about the direction we're heading. And yet at the same time, we see studies that many lower and middle income countries may not have full access to the vaccines for 2 years or even 3 years from now. And so the initial goals of COVAX, as many of our audience be familiar with, this is the sort of co-led pillar by Gavi and the Coalition for Epidemic Preparedness Innovations. So this international cooperation platform, their goal this year is to provide 1.3 billion vaccines to 92 low and middle income countries, which would just reach a 20% immunization rate. COVAX is off and running now. It has shipped over 67 million vaccines to 124 countries, but there's a long way to go to get to those goals I was talking about of 11 billion vaccines having been administered, or even just getting to those levels of 20% immunization. And what we see at the same time, unfortunately, is a growing disparity between the access of vaccines in wealthier countries and poor countries. So on average, 1 in 4 people now in high income countries have received a coronavirus vaccine, compared with 1 in 500 in low income countries. On the continent of Africa, only 2% of the global produced vaccines have come to the continent of Africa. And in addition just to access, and I think one of the core issues we're going to discuss today in terms of effective delivery and looking at the full supply chain from the manufacturing sites to getting the vaccines administered, 2 examples that jumped out at me. One was that we saw in Malawi 16,000 doses that expired of the AstraZeneca vaccine because they weren't being able to be administered in time. This is just in the last few weeks. And then reports that we saw in the Democratic Republic of the Congo essentially returning 1.3 million vaccines, again, the AstraZeneca vaccine, because they were set to expire before they could be administered. So I think what we're seeing here is great potential in terms of public-private partnerships that came together around manufacturing of vaccines. And now we need to see those same types of partnerships and the same type of scale achieved as it relates to delivery. So with that in mind, I'm going to turn now to our speakers. And our first speaker, as Hannah introduced, is Sibusiso from PATH, who is their country representative in South Africa. And so Sibu, it's great to begin with you because as I mentioned, we're seeing sort of a different type of response around the world. And I'm sitting in Washington, D.C. in the United States, where there's been encouraging signs, getting our population to more than 50% being vaccinated. But we know that that's not uniform around the world. And I thought maybe you could help Sibu set the scene in terms of looking both within South Africa, but perhaps looking more broadly across the continent and sort of low and middle income countries, what you're seeing in terms of the current state of the response as it relates to delivery of vaccines and other sort of health solutions. And then also, what are some of the constraints that you see as it relates to manufacturing, health systems, et cetera? So thank you again, Sibu, for joining us, and I'll open it up for your thoughts.
All right. Thank you, Porter, and thank you for that wonderful introduction and laying off of the landscape. A few minutes ago, actually, I was listening to Dr. Tedros, the WHO briefing that was just happening now. And one of the things that resonated with me is that no one is safe until we are all safe when it comes to COVID. And as such, it is important to ensure that resources are made available for all countries in the COVID response. You've made good examples. You've made examples of DRC and Malawi, and they're not an exception to many or most of the African countries. So leaving any country from accessing vaccines, especially low and middle income countries, will continue to cause significant economic damage and also put economic progress that has been made both in low middle income countries and also in advanced economies alike. You'll continue to draw them back. So you've mentioned COVAX and you've mentioned ACTA. I think these are initiatives that need to be supported. I think world leaders need to continue to pour more resources towards those resources. It is discouraging to learn that we are not getting as much, or WHO is not getting as much support resources as initially thought or planned. And then you have mentioned the 67 million doses that have gone out from the COVAX, which is the vaccines pillar of ACT Accelerator. Now, you've mentioned there are constraints. There remains to be quite significant constraints, both for South Africa and African countries and other low middle income countries. One of the constraints that's there is on manufacturing. So currently, Africa produces less than 1% of the vaccines that are needed, and that is even before COVID. Now, with the world grappling and everybody grappling for vaccines, we're in a continent where we're saying, how do we increase our manufacturing capacity for vaccines? How do we get the 99% to come out of Africa? There are discussions already on technology transfer for COVID-19 tools, especially vaccine development. These are discussions that need to be amplified. These are discussions where we need commitment from both the private and public sector to be implemented. We need those countries that have got the capabilities to make meaningful plans in terms of how do they share those capabilities with continents or countries such as Africa. We need models for building vaccine manufacturing hubs in Africa. Africa CDC is already Africa CDC, the African Union, out in NEPAD, WHO, Afro are already having discussions, and I think these are discussions that need to be that need more political will. They need to be amplified. We need countries, we need African countries as well to contribute in terms of how do they become part of these discussions and this initiative. So there's also a need to look at sustainability models as well to ensure that when these manufacturing hubs become available, they are sustainable and they are viable and they are there for the long term. So I think as much as COVID-19 has exposed a lot of gaps, it has also shown us what needs to be done. It has also provided opportunities for first world countries to collaborate with developing countries in terms of manufacturing and in terms of ensuring that there are investments into all the aspects or all the critical aspects of manufacturing, including clinical trials, issues around active pharmaceutical ingredients being made in the continent as well, and also in terms of uplifting countries and African scientists to be part of the solution. Listening to the examples that you've made around Malawi and DRC, they speak to one thing basically. They speak to the need for Africa and African countries and developing countries to invest into health system strengthening. So we sit with countries that have had health systems that were strained even before COVID, and currently they're faced with the prospect of having to vaccinate everyone when they could barely cope with other pandemics that different countries are struggling with, such as TB, HIV, malaria, and others. So now to add the vaccination component to say everybody needs to be vaccinated, it is such a tall order. And as such, unless there are investments into these health systems, we will continue to see a wastage in terms of vaccines expiring, in terms of vaccines not being potent because basic things such as cold chains could not be maintained. We'll continue to see some disparities and a lot of because of uncoordinated systems or inadequate systems in terms of health systems or data management systems. For example, the AstraZeneca vaccine, you have to get, or any of those vaccines where you have to get more than one dose. We need to have a system that's able to track how many people have received the dose, how many people are due, when are they due, and need to have mechanisms to ensure that they are aware and reminded that they are supposed to come back. These are issues that look quite simplistic, but in actual practice, they are not. We also need to look at, investments into issues around surveillance system. We talk about, there've been a lot of discussions around vaccines starting and stopping because of adverse events. Some countries do not have the capability to ensure that, or to monitor, or to have a surveillance system around those. So those are some of the things, those are some of the issues that African countries or developing countries are grappling with. Another issue is that of purchasing power. COVAX will only cover a certain percentage of the population. Other countries do not have that purchasing power to fill the gap that's going to be left by COVAX. And the world needs to look into how do we ensure that everybody gets access to these vaccines. And then I've mentioned issues around health information system, and then we've got issues around regulatory harmonization. If these are not solved, and I know there's a lot of work that's going on, and PATH is part of that in terms of ensuring that you've got harmonized regulatory systems on vaccines. When vaccines are approved in one country, and we can use like what Europe will do in terms of having harmonized regulatory systems. There is also the project for emergency approval of vaccines. There needs to be some investments into ensuring that countries do understand how to access those vaccines and how to expedite the approval processes for vaccines. So those are just some of the issues around systems risks and financial risks that African developing countries face. And I think there's no better way to say this, but until no one is safe, until we are all safe, as WHO keeps telling us. So it is important for countries to collaborate. It is important for the private sector to come on board as well and collaborate with governments and collaborate with regional and continental bodies in ensuring that there is equitable access to vaccines, and the challenges and bottlenecks that continue to be encountered by different countries are addressed in a comprehensive manner. Thank you, Potter.
Thank you, Sibu. Really appreciate the perspectives and kind of helping to set the kind of problem statement that some of the innovations we're going to discuss next are designed to address. So our next speaker, Ben Hubbard, as Hannah introduced, is the CEO and co-founder of Parcel. I worked with Ben earlier in his career, and he was at USAID, where he served as chief of staff. He also led the Development Credit Authority, the loan guarantee program within USAID. So Ben, as Hannah mentioned, you joined Concordia's annual summit last September at the time to discuss the launch of the Global Health Risk Facility. It's a unique sort of innovative partnership working between the public and private sectors. And now that platform is being deployed in the context of COVID response. So I wonder if you could do two things, Ben. One, sort of explain to the audience, what is the Global Health Risk Facility? What platform here has been created? And secondly, how is this being utilized when we look at delivery of vaccines and we look at disparities to improve access? So with that, over to you, Ben.
Great. Thanks, Porter, and nice to be back at a Concordia panel. So let me first just say real quickly what Parcel does. We're a technology-driven insurer of essential supply chains. So we focus on things like vaccines or perishable food, temperature-sensitive products. And we use data, namely granular data we collect from low-cost sensors. This is an example of just a domino-sized sensor that rides with a vaccine and understands the quality conditions that it goes through. And we use that data to be able to lower the risk. We also use it to be able to underwrite risk and provide insurance to some of these tougher to insure products. And so we created something called the Global Health Risk Facility, along with a dozen other global insurers, with support from the Development Finance Corporation and Nafisa directly, and she'll give her perspective on this. But it was really around addressing a market failure that has persisted in this space for a long time, which is driven by a lack of data and information. So goods are, life-saving medical products, commodities, vaccines, more often than not go uninsured once they land in a country. So title transfers to a government, usually a government because we're dealing with public sector supply chains for the most part. And governments find it very difficult or impossible to protect those products from an insurance perspective. You've got millions of dollars sitting in warehouses. Sometimes they burn down, sometimes the power goes out, cold rooms get lost. And so you lose these important products. It really stemmed from an inability to understand where are the risks that are being insured, what are the values in those locations, what are the products, what are these buildings made out of, just really basic information that insurers need to be able to underwrite these risks. A lot of that was missing. Obviously, these are high risk products in weaker infrastructure environments. So you just had a mismatch between what an industry, that being the insurers, could offer and what countries needed. And so we tried to address that gap through a couple ways. One was better data and information. So working with some of the strategic partners, Geneva-based organizations, to be able to understand, basic things: where the locations, where the building's made out of, using local firms, local risk adjusters and surveyors to do site surveys. Very inexpensive way to gather the appropriate information, using sensors to understand the cold chain better and where those breaks are happening. But we still needed more insurance capacity to be able to ensure, the kind of values that we're looking at with COVID-19. So we have something called a syndicate at Lloyd's. You can think of it as an insurance company, a vehicle that we set up called Syndicate 1796. It's backed by the DFC, and it's sharing 50% of the risk that we take when we underwrite these life-saving products, the other 50% being taken by other major global insurers. So we launched this in January. Very happy to say we're off to a great start. And I should say it's not just for COVID-19. In fact, some of our first deals were non-COVID-19, certainly related, had diagnostics products for COVID-19, but HIV, AIDS, TB, malaria, lab equipments, reagents, and whatnot are all part of the scope of this. And we can insure now products that are moving from a manufacturer to a country. We can insure them from a manufacturer to the patient, or from the arrival in a country to a patient. Really anywhere along that important supply chain, we can come in and support it with a risk transfer solution, as well as risk management. So this initiative includes the likes of AXA and Chubb and major global insurers, the Lloyd's agency network, who have experts on the ground. These are local firms who can go out and provide these services to help protect these products and get ahead of problems before they start. And so I think one of the exciting things for us is, this is something we had been working on prior to COVID-19. This was an issue for routine immunizations, for standard AIDS, TB, and malaria drugs. And so the timing of COVID, we're able to bring this industry, that being the London insurance market, in service of this. And as we look at what these exposures look like, they have real implications for countries. I was speaking to the World Bank recently. Countries are spending between 1% and 3% of their GDP to finance COVID vaccines and response. Most of them are borrowing that 1% to 3%. US government just put in $4 billion into Gavi and COVAX. And, in any other domain, this is something you would take very proactive risk management and control measures to get ahead of. And so in this sense, we need to take that really seriously, especially now that we have solutions available to countries, to global organizations. So we're excited about being able to protect, that borrowed capital or that taxpayer investment in these products. But frankly, more importantly, is it gets the private sector into these supply chains with skin in the game. These are predominantly public sector supply chains that just haven't had, and I totally believe in public sector health, but haven't had the rigor and discipline of private sector risk management and control. And there's a lot that you can do very quickly and very easily to start to make some improvements in this. So I think that's the most exciting part about this initiative, is just really bringing a whole new set of capital and problem solvers to improving these supply chains. Because the truth is, this isn't just a short-term response. And I think anything we can do now to lay the groundwork to make these more resilient supply chains, it'll help us, with the next pandemic, with all the other products and services that donors distribute around the world.
Thank you, Ben. And you answered the second question I was going to ask you about, sort of the broader applications of this, because obviously it's not just limited to COVID vaccines, and you described that well. We're starting to get questions coming in. So just to the audience, as a reminder, as you're hearing from the speakers, please feel free to send in your questions. And then in the latter portion of the program, I will address those to our speakers. So Ben, you addressed, I'm going to turn to our next speaker with this, the sort of the volume of investments that are being made by donors or loans that are having to be taken out versus the World Bank or otherwise, which gets us to the next piece of the discussion around access to finance and some of the working capital requirements. So with that in mind, I want to introduce our next speaker, Sean Keogh, who's the Vice President for Financial Solutions at Nathan Associates, an international development company that works with leading donors like USAID and the Foreign Commonwealth Development Office and other donors. Sean shares some background with Ben, so he also worked at the Development Credit Authority at USAID, where he led their strategic transaction group, worked on a variety of financial instruments, including blended finance, project bonds, development impact bonds, pooled finance mechanisms. Was able to do that because he spent a substantial part of his earlier career in the financial services sector, where he worked with firms such as Aldwych Capital Partners. He worked with BNY Mellon, Citigroup. And so, Sean, I've learned over the last few weeks and some conversations with you about a creative approach here, looking at, again, these working capital requirements. So the companies on the ground that are actually going to lead the delivery in partnership with the public sector, as Ben said. I wonder if you could just tell the audience a little bit about sort of the perspective you're bringing to this access to finance set of requirements, and then also what sort of structures, given your background in blended finance and kind of the role of the donor institutions alongside the private sector to try to effectively marshal the capital where it's needed as it relates to the COVID delivery challenges. So with that, I'll turn it over to Sean.
Yeah, thanks, Porter. And thanks, Concordia, for hosting this panel. I think it's a really good conversation. I'm already learning a lot from Sibu and Ben. And, I think it's a familiar story to some extent. When you have massive mobilization of government efforts, things get a little bit bogged down just in terms of how the money flows. It typically flows slowly, although in this case, it's a bit faster. But, you see articles even with COVAX and the challenge around just getting countries to draw down on financing. And ultimately, when you look all the way down the line, when you get on the ground and the distribution of vaccines, getting, trucks and even motorcycles in some regions, cold storage, you name it. Most often these are private sector entities that are businesses that are trying to facilitate this logistics chain, right? And at the end of the day, they don't have a ton of free cash flow available, not for these new initiatives where they want to support and expand. So they need, working capital, in some cases, even a CapEx financing. And while entities like the DFC are really important to help with these sorts of financing challenges, I'm sure Nafisa would agree, it's a lot more effective if you can partner with the private sector and private sector investors as well, because, just the same reason the SDGs came to evolution from the MDGs, which is you need private sector involved. You just can't solve it purely through a donor lens. And so, what we've identified, I've talked to fund managers from my old life in New York, and Nathan has about 40 active projects in 40 countries right now. So we have a lot of evidence where there's these pain points, in particular around supply chain, working capital. And what we're identifying is there's a bit of a gap where you have the top level financing, at least trying to be addressed. And then you have a lot of, logistic solutions going into how this vaccine distribution will take place. But there's still a pretty big missing piece of how, financing can help speed this delivery up. And, if it's continued to be viewed as an afterthought, maybe not with this particular panel, but, just in the larger realm, you don't want to turn around and look back and say, oh, we forgot about the financing of the cold storage from a private sector perspective. And so, again, having talked with fund managers, we've identified a more efficient solution to partner with the public sector, as you mentioned, Porter, from a blended capital perspective, to really leverage a much larger amount of money for this vaccine distribution initiative at a global scale, which would, require, of course, a number of different sources of capital for the fund, primarily driven through the private sector banks that we've talked to. And then ultimately, you need local specialty finance firms to actually distribute the financing on the ground. What we're trying to do right now is really refine and quantify, what the best solution is from both the speed perspective and where the key gaps are from a financing perspective. So, part of it is to continue to build these partnerships, to solidify the fund structure, but also just, learn from the panel here and the audience to see, what can we learn from these kind of collective efforts and sharing information. And ultimately, I think Sibu hit it in nail on the head where, you need a sustainable solution, right? You can't like go in and put a Band-Aid on and then walk away and think that in the long run is gonna solve the problem. And so what we're looking at, again, through this financing solution is really a private sector driven approach where you're identifying gaps that would benefit from the financing and be able to have a sustainable business, beyond the donor involvement of the capital. So, based on timing, I'll leave it at that. I'm sure Q&A is probably going to be a bit more relevant for this. And I want to hear what Nafisa has to say.
Thanks, Sean. Yeah, and before I turn to Nafisa, I'll just reiterate, I happened to be reading an article this morning in DevX entitled The Cold Chain Storage Challenge, which is from the end of last week. And for our audience, I commend it to you, but this is just a quote from that. I'd heard of this study before, but last year, the World Bank, WHO, UNICEF, Global Fund, Gavi, they did a joint readiness assessment of over 100 low and middle income countries and actually found pretty good baseline capabilities as it relates to delivery. But on cold chain, it was only 50% of the countries assessed had the capacity needed to deploy vaccines, and that was just against regular temperature vaccines, so not against those that have lower, and much more challenging temperature requirements. So just to kind of echo the point there, Sean, I mean, the baseline isn't sufficient, so you got to invest. And we don't just have private sector investment; we have donors. We have development finance institutions, and so I'm delighted to turn to Nafisa Jiwani. Nafisa is the managing director for health sector investments at the DFC. She also, over the last year, helped lead their COVID task force. So Nafisa, welcome, and I'm going to turn it over to you to talk maybe a little bit about what has the DFC strategy been to try to address these, the challenges from manufacturing to delivery. Maybe you could speak to a couple of the kind of investments that the DFC has made. And as Sean said, maybe we'll leave a little time open in the end for our audience to ask some questions. So I'll just start with that. And thank you for joining us today.
Sure. First, I want to say thank you for the opportunity to speak on this esteemed panel and for the opportunity to contribute to the incredible work that colleagues on this panel are doing. I've said this before, and I'll continue to say it. I really do feel like this is the time to use crisis as an opportunity to respond to both the immediate needs right now, and for us to address the mid to long-term needs around health system strengthening and vaccine manufacturing capacity. I think, if you're in the public health sector or global health, there is no better time than for us to use this to ensure that there is a much stronger system to manage pandemics in the future. This cannot be how we approach things worldwide. I also feel like this is an opportunity for us to think strategically about how to expand and create diversity around vaccine manufacturing. So we can't be looking at this worldwide and assuming that only one vaccine is going to be the right vaccine for every single region. So thinking about what is this regional approach and how do we make sure that there's diversity around the technology around mRNA versus viral vector, that sort of thing as well. Additionally, I think Sibu had pointed this earlier, for us to make progress, we're going to have to take a multi-pronged approach to move the needle around the legal and regulatory environment that is, not a small issue by any means. The support and capacity building needed around tech transfer and IP. Again, these are big issues that countries are facing as they're trying to get up and right to either do fill finish or to expand their manufacturing capability. So we need to be thinking about the technical skills required around this area as well. And then what does procurement look like for countries? I think the African continent has had several sort of convenings to talk about what does procurement need to look like so that there is a strong business case for manufacturers to expand. DFC is deeply committed to supporting expansion of vaccine manufacturing. We are currently in discussions with several manufacturers around the globe to understand what the roadblocks are and how our agency can either support using our tools around debt financing, political risk insurance, our technical development program, What are the things that DFC can immediately do, and then how can we bring in other partners? And if that means the rest of the United States government, either with technical expertise from colleagues at BARDA or NIH, then let's figure out how to do that together, because this is going to require both the technical expertise coming in as well as the financing to marry those two things so that we can actually make progress, especially around vaccines. We're also speaking to both biotech and pharma to understand where there are opportunities to support them around vaccine supply chain. And that means everything from the raw materials that are required to actually do drug substance all the way to distribution. You need to be able to build an entire ecosystem around that. So if DFIs are working together to de-risk and deconcentrate that risk from one DFI to another, we need to also be thinking about the entire ecosystem required for this to be sustainable long term. So I'll give you an example of what we're doing right now, and this has been announced as well. We're supporting a vaccine manufacturing company in India called Biological E. And what we're doing is working to provide financing to allow for increased capacity to support Biological E's effort to produce at least 1 billion doses of COVID-19 vaccines, specifically with the Johnson & Johnson vaccine. The idea is that 1 billion will be unlocked by the end of 2022, which is again, far from today. The financing will increase the distribution of those vaccines across Southeast Asia and the world. And we're hoping to use what we're learning from that project to contextualize our opportunity to do things in other countries as well. As part of our response, DFC has pursued investments to support increasing liquidity for small and medium-sized businesses, especially women-owned businesses. And I think that all of us can agree this is a time when we know that women are disproportionately impacted by pandemics. And I think that we've learned that from the Zika crisis, we've learned that from Ebola, and we're seeing that, of course, from right now as well. In addition to investments through our debt and equity program, we continue to work on technical assistance and building expertise to respond to critical challenges. And I think that at least for our work with Parcel, I have to, hats off to Ben and his team, because, you all worked night and day to push this forward. I don't think without that sort of due diligence, we would see a vaccine being delivered to countries that otherwise wouldn't receive that insurance.
Thank you, Nafisa. And thanks to all the speakers for trying to be concise so we could save a little bit of time for the audience. So I have a few questions, and the first one, Ben, is addressed to you and Parcel. And so a question from the audience was, can Parcel Global Health Risk Facility ensure underwrite donated vaccines? And maybe put that in the context of, and I meant to allude this in the beginning, I was talking about the potential for manufacturing capacity really spiking. We've seen the US government committed 60 million donated vaccines. Actually, during this session, committed another 20 million. President Biden did, with the expectation we might get to 300 million in July. So how does Global Health Risk Facility address those donated vaccines?
Yeah, we can absolutely ensure donated vaccines. That's a lot. I mean, if you think about even what we're doing now, we work, I think it's publicly out there, we work with a partnership for supply chain management. They're a major procurement agent to the Global Fund. Global Fund products are donated products. So someone at some point is paying for the product, and so we can ensure anyone who's sort of at risk of a loss, whether they're selling them or donating them.
Thanks, Ben. That was great, because I'll do kind of rapid fire here so we can get a few of them going. Sean, I had a question to you, which was kind of getting at the mechanics of addressing these kind of working capital financing gaps and requirements. So the question was sort of what's needed on the public sector side. Since we were talking about public sector supply chains, we were talking about the DFC, talked about other actors like Gavi that are using public sector funds. Like, what's needed from donors was the question to get something like this going, to create access to working capital.
I mean, if they ask anyone in finance what you need from donors, you're just going to say everything. And all joking aside, I mean, you really do. You need one. Again, it's the same story on both sides. You have the DFC would benefit greatly from leveraging private sector capital. Private sector capital benefits greatly from leveraging donors and in particular DFIs with investable money. You just bring a lot more to scale, and you have a lot more efficiencies from pipeline development, due diligence, and everything, because you're working with larger size. But with that, takes then a funneling approach where you need to get it on the ground. And if you're dealing with, say, let's call it a global facility or a regional facility, it really is difficult to tackle challenges in a very tailored way on various supply chains in different countries where their characteristics are going to be different. And so at a facility level, if you're calling it a facility, the fund size, it needs to go then to another level of, say, local capital providers. And I mentioned specialty finance, where they provide that unique sort of financing like factoring as an example. All of that needs risk mitigation as well. And so again, you need to go back to the donor community and see what sort of risk mitigation tools can take place. I mean, arguably this is, while vaccine delivery is not a new space, we're venturing the new territory here. Cold storage is a different animal that it is for other vaccines and so on. And so, there's a, whether it's just perceived risk, there is risk. And so you need risk mitigation tools like guarantees, like grants that can be used as first loss capital. And then just, all the legwork that's required to set this up. If you really want to move fast enough, which I would say we're already behind, you need support, operational support just on the front end to get the energy focus from all the different partnerships and stakeholders to actually establish the fund, get all the documentation in place, get a real pipeline as opposed to an indicative pipeline, and then, identify where the money is going to get put to work. I mean, that just requires a lot of person hours and resources to just get off the ground. So we're doing that now. Nathan's committed to setting this up. We're working with 2 fund managers that are looking at a joint venture to establish the facility and really move this along. But we always need the partnerships and support to actually see this all the way through from the beginning. So yeah, it is all of the above, but it's kind of a legged out process.
Thanks, Sean. Very helpful. And then Sibu, I'm going to turn to you in this next question, which kind of gets to comments both you and I made when we were doing a bit of the kind of landscaping in the beginning. But the question is addressing how do we ensure, particularly in low income, low middle income countries where you have refugee or internally displaced person populations, that they are also having access to vaccines. And I'll take this on with you, but I might, kind of draw on some of your on the ground experience as well. I don't know if that's something that PATH or you have looked at, whether it's in the context of South Africa or more broadly in the region of, we do have migratory populations, we've got refugees and IDPs. How do we ensure that they're getting access? So any thoughts on that you may want to offer?
Right, thank you, Porter, for that. So I think what's currently happening on the ground is you've got phases in terms of the rollout of the vaccines. I'll make an example of South Africa. I think the first priority is healthcare workers, and then it's older populations. And I think governments have got a strategy in terms of the different groups and how they'll be accessing the vaccine. So I think it should form part of that national vaccine strategy. Healthcare is a right for everybody. So it should be that people should be able to receive the vaccines. I haven't looked at where displaced and refugee people fall in terms of the different phases of the rollout, but I'll be surprised if they have not been catered for. They should be catered for.
Yeah, and I've seen COVAX and Gavi and WHO and others speak to this, and I think you're right. I mean, that's built into the access plan. I want to be sensitive to the time, so maybe just in a quick 30 or 45 seconds, Nafisa, it would be great maybe for the audience's benefit, in addition to the DFC's sort of COVID response work, and you're talking about kind of longer range investing in health systems and capabilities, maybe you could just mention what the Global Health and Prosperity Initiative is and sort of what the scope of that, I think, is going to be a big part of how the DFC looks for longer term solutions.
Sure, thanks so much, Porter. So we launched the Global Health and Prosperity Initiative a year ago almost. And the focus of that initiative is to invest $2 billion across 3 years in the global health space. And when we were developing the call for proposals, we really were looking at what are all the types of investments that are critically needed across the health system. And so if you look at the call for proposals, you'll notice that we are accepting proposals all across the spectrum. So if you look at public health initiatives around WASH and food security and nutrition that we think are foundational and critically basic needs for people, we're looking at projects around that, but we're also looking at, you know, vaccine manufacturing, diagnostics, therapeutics, and aspirationally R&D, where we feel like that might be a safe investment for us to make as well. So you'll look at the call for proposals, you'll notice that spectrum, and that's by design because we really want to increase our footprint as an agency in the global health space. Thanks so much, Porter.
Yeah, thanks, Nafisa. And we're at time, so I'm going to draw us to close just by thanking our speakers for taking the time, for offering their perspectives. These are some exciting solutions. We also, I think, got into some of the big challenges that require a lot more work going forward. With thanks to Concordia and this Concordia Live series, I was saying to their team at the outset, I've learned so much tuning into these over the last many months, and there's more to come. So keep coming back. And the Concordia team had offered that we can send out to the members of Concordia some additional information on these efforts, which we'll do afterwards. But just thanks again to our panel and wish them and everybody else a good day.